So what does it mean to wake up a dormant ovary? Is it hope or hype? Well, you have to stay with us today because what?
Oh boy, where did you get that one from?
Okay, so you would have to stay with us today because what you would hear today would challenge everything you've ever known about fertility. So, Dr. Ken, let's talk about ovarian rejuvenation. But before we go into ovarian rejuvenation, I think we should talk a little bit about the ovaries.
Oh, okay.
Yes, and then the role that it plays in fertility.
Fine. Okay. So, the ovary is the female organ of reproduction, or one of the female organs of reproductions. They are in pairs. That's to say, a normal woman has two ovaries that are located in her pelvic cavity, just close to the uterus, and they are so arranged in a way that the fallopian tubes hugs them, so that when the eggs are released, it picks up the eggs and the eggs goes through the fallopian tubes where fertilization happens and all of that. So the ovaries are there at birth, and have lot of eggs in them.
Okay. Between
400 to 700,000 eggs at birth.
At birth, okay.
Yes, and then when a woman starts menstruating, these eggs start depleting in numbers, and as she's aging, they are deteriorating in quality. And there is an index we call ovarian apoptosis index.
Okay.
It increases as a woman is aging, and the number of eggs are decreasing, and the qualities are deteriorating too. The ovarian apoptosis index rises or increases, okay? And all of that means that the quality of eggs, the number of eggs are reducing, and the chances of getting pregnant is reducing, and all of that. And when the ovary stops functioning completely, when it's out of eggs, and by the way, a woman loses about 1,000 eggs monthly from the time of menstruation when she doesn't get pregnant.
1,000 eggs.
Exactly.
Wow.
And the 1,000 she loses this month are better than the 1,000 she's going to lose next month. Better than the 1,000 she's going to lose the months following, and on and on. So while the number is reducing, the quality is also reducing. The apoptosis index is increasing.
Okay.
And some lifestyle that she indulges in, smoking, some aesthetic drugs, and the kind of cosmetics, chemicals, environment, and all of that worsen the ovarian situation. And then she gets to a point when she's out of eggs, or when the ovaries are out of eggs, and then we get to the menopause. And this happens at different stages, at different times for different women. So you cannot say it happened at 40, for instance, for all women. For some women, it happens at 20.
Wow.
Yes, I just saw 20 just not too long.
Interesting. So what do you call that?
You call it premature ovarian failure, okay? POF, premature ovarian insufficiency right now. That's what the word that's used. So it happens at different times. So no women have the same biological clock. It differs between one woman and the other. And why some women have very extended, prolonged ovarian age, some have very short ovarian age. So that's in a nutshell what the ovary does.
Okay, so now that we know what the ovaries are and then the role they play in fertility, can we dive into ovarian rejuvenation? Because from the word rejuvenation, it's just, to me, I feel like it's bringing back life, right?
Exactly.
So what does ovarian rejuvenation mean for someone who is probably hearing this for the first time?
Oh, well, just in case current reproductive scientists are listening to us, I'm aware that we are changing the name from ovarian rejuvenation to ovarian activation.
Oh, wow.
Yes.
Wow.
Yeah, in our last professional meeting in Denmark, in 2023, is a meeting of European Society of Human Reproduction and Embryology. We had heated debates against using the word rejuvenation. We're calling activation. And that presupposes. That's why I was wondering where you got that word dormant from. So like you've been to the conference or you were in the meeting where those arguments were made. Well, in any case, science is full of controversies, and but the controversies is in attempt to get the right semantics that will depict the right situation that is being discussed. So ovarian rejuvenation, if I use your word, is a process of bringing back activity to the ovaries. Activities now means regrowing eggs, from the position where you have egg exhaustion, to improving the quality of eggs in situations where you have poor quality of eggs, to the point that you have hormone activities that is slowing down the process of menopause. Exactly. So that's in a nutshell what ovarian rejuvenation is. And there are a lot of areas where you have application of this process in reproductive medicine.
Great. So who needs a process of ovarian rejuvenation?
Okay, now women or couples need it. Let me not use the word woman. Couples need it. And what we observe in reproductive medicine or in assisted reproduction is the fact that large pool of our clients have need for egg donation. And some of the clients come from a cultural background or religious background where egg donation is not acceptable, or even their own personal feelings, doesn't accept egg donation. So people who need them are those who are out of eggs, those who have poor quality eggs because of aging, and are considering an IVF treatment cycle and don't want to accept egg donation. So it's an option that they can utilize to improve on their chances of using their eggs to achieve pregnancy. Those who also marry at advanced age, who may not need IVF, but are sure they have reduced quality of eggs, or poor quality of eggs, or are running out of eggs, could also have ovarian rejuvenation and achieve spontaneous conception without all the problems of ovarian aging.
Amazing.
Yeah.
Now, looking at all the benefits that we have mentioned and the possibilities of ovarian rejuvenation, I'm just very curious. How is this process being done? What's yes, because I'm sure someone is listening and is also curious. How can you perform this magic? It sounds magical. Like, do you use a wand to just transform things? So how is it done?
Well, the way it's done is this. First of all, you evaluate the woman, and she meets the criteria for ovarian rejuvenation. That's to say, she's advanced in reproductive age, egg qualities are low or poor, or the numbers are reduced. And these are by either ultrasound investigation or laboratory blood chemistry investigations, and all of that. You have maybe the FSH and LH may be normal or high, and the AMH may be low. So these are some investigations to do before that time. Then, of course, you access and be sure that the ovaries are accessible by ultrasound. Because the procedures is done on that ultrasound guide. So you just get some quantity of blood from the woman. So, and there's a fraction of the blood that is extracted, the part that is rich in platelets. When you get the blood, you spin the blood through some certain revolution, 1,200, 1,500 revolutions per minute, using a plasmapheretic device or machine. Then you get that fraction out. When you get the fraction out, you just take the woman to the procedure room. Under ultrasound guide, you inject it into some spots on the ovaries.
This is incredible.
That's all that is done. So there's no cut. It's just with the aid of a needle under an ultrasound guide. So you just inject it into various spots. A woman may need 1, 2, or 3 sessions before undergoing an IVF treatment cycle, or before taking her chance on spontaneous conception. The procedure may just last like 3 minutes.
Oh.
Yeah, the process of extracting the blood fraction may take up to 20 to 30 minutes. But of course, it's done in the laboratory. But the process of injecting it onto the ovaries may just last 2 to 3 minutes.
That's
and you
simple.
Just sedate the woman a bit so she doesn't feel pain.
Okay, so for a woman who has undergone this procedure, how long does it take from the time of the procedure till the time where, for instance, she wants to undergo an IVF treatment?
Yeah.
How long does it take between the time she had the procedure and when she should start her IVF treatment cycle?
Okay, now depending on the woman's physiological condition, if the ovarian reserve are badly depleted, for instance, you want to do 2 to 3 sessions, before chasing for her eggs. Then for those who want to conceive spontaneously, you could just be doing it while they're trying their spontaneous conception. It can happen at any point and they achieve their spontaneous conception. So there is no hard and fast rule about that. It all depends on the goal and the state of the body before the commencement of the ovarian rejuvenation process. Well, in this part of the world, I think we started it quite a long time ago.
Okay.
And then we've had interesting stories to tell about it. We've seen women with young ladies in their late 20s with premature ovarian failure who have had that and have delivered babies in Nigeria and outside the countries through our intervention, okay? And sometimes we add other additives to them, like colony stimulating growth factors could be added to them. Even the follicle stimulating hormone could be added to them. Sometimes growth factors could be added to the PRP, this platelet rich plasma that is produced that's extracted from the blood. It all depends on what you're dealing with and what is accessible to the woman. And you could do all of this to just make her try to achieve pregnancy using her own eggs, because I don't know, for some weird reason, women are so attached and sentimental to using their
own eggs, right? Okay, so for most women, safety is usually the concern.
Oh yeah.
So can you say that this procedure is a safe procedure?
Yes, it is extremely safe. Very safe.
100% safe.
Oh well,
no side
I can't
effects.
use the word 100% safe because this is a medical procedure, and even when you think everything is fine, something can just go wrong, but it is one of the safest procedures in medicine, because all that goes through the woman is a needle, just like giving a little child an intramuscular injection, but this time the needle is going through the vaginal wall, piercing through the peritoneum, the covering of the pelvis, the peritoneum, that has little irritations, maybe pain and because of sensitivity. But you block the pains with your pain blocks and your sedation. So there are no side effects. If there are side effects, I see maybe a little pain afterwards.
Okay.
Yeah, so
it's
pretty safe. Very safe.
Like the sound of
like
that.
in scale of 10 over in scale
1
of
to 10.
1 to 10, 10 over 10.
10 over 10.
Yeah.
Wow. Okay, so sir, just for some women with some ovarian reserve, right? Is there a chance that this rejuvenation could accidentally overstimulate the ovaries?
No, it's not likely.
Okay.
It's not likely because the rejuvenation doesn't take the ovary back to normal, like when she was 20 with hundreds of thousands of eggs. It's just to produce some level of eggs, for just some incidental uses.
Okay.
You understand? So a woman cannot
go
overstimulated in a treatment following ovarian rejuvenation. It's practically almost impossible. You still be struggling to get eggs. This is just to say that it's not to make ovarian rejuvenation sounds magical. Egg donation is still superior to it.
Oh, wow.
Exactly. It's just an alternative for those who wouldn't want to accept egg donation.
Something just crossed my mind. At the pace that science is going right now, do you think we would have a time where menopause could be reversed?
This actually reverses menopause. Yes. As we speak right now, there are times you could do even procedures to postpone or delay menopause.
Wow.
Let me for instance, when a woman is not ready to give birth to babies, even the ovary itself, a chunk of the ovaries can be taken and dies into pieces. Let me use a kitchen language now.
Did you just say dies?
Dies into pieces and cryopreserve, and allow her to continue. When you dice them in pieces and preserve them, and then the woman, let's say the woman comes 20 years later, and then you now transfer the preserved part of the ovary onto this woman. These ovaries are 20 years younger than the woman's chronological age.
Wow.
So what you've succeeded doing at this point is you are like postponing or delaying menopause. You are prolonging her reproductive life because she'll be producing eggs.
Whoa.
And the egg she produced at that age, maybe when she's 40, 45, will be as good as the egg
she would have
of a
produced
20,
at 20.
because when you freeze those diced or chopped ovaries, they stay at the age. Because no metabolic activity is going on in them, so they stay at that age. So these are procedures already that are accessible, either for reproductive reasons or for endocrine reasons, either for reproduction or to delay menopause. Because menopause is a big issue. It's a very, very big issue. The world doesn't talk much about it, but it's a big issue.
Well, it's great to know that there's hope.
Yeah. So when you have all of this procedure now, you start thinking of ovarian activation. Ovarian activation. So when you do the rejuvenation using the PRP, what it does is this. I expected that you asked me the question, but since you didn't ask, let me ask myself. What it does is this. The platelet-rich factor are like precursor to stem cells. They create a chemo attraction to stem cells from different parts of the body towards the ovary. And if you look at physiology, what stem cells do is this. Stem cells are usually cells that are not native to any part of the body, but wherever they find themselves in the human body, they become local to that part of the body and now begin to reproduce or act as if they are the organs in that part of the body. So, because the whole part of our bodies was produced from one stem cells. When they move to the eye, they become the eye. They move to the ear, they become the ear. They move to the heart, become the heart. So they move to the ovaries and becomes part of the ovaries again. So that is the word rejuvenation. So the ovary begins to function again. Because it's like stem cells. So, and there are a lot of products that are used. So direct stem cells can be used.
Yeah, I was going to ask.
Direct stem cells can be used. Precursor stem cells can be used. And tissues or cells that attract stem cells can be used. So these are different tissues or cells that can be used for ovarian rejuvenation.
So it's not just a PRP peculiar procedure. Because I think I had seen claims that said that the stem cells were more effective than the PRP.
Exactly.
So you agree with that too?
Yes. Exactly. So these are all the things that can be used for ovarian rejuvenation.
Amazing.
And by the way, it's done everywhere in the world. Maybe not everywhere in the world, but it's done in a good number of places in the world. A good number of centers in Europe are doing it. We are among those who started it in Nigeria. You could do that in US, you could do that in England, you could do that in India, you could do that in Bulgaria, you could do that in a lot of places.
Amazing.
Yeah.
So what's the percentage like in terms of number of women who actually achieve conception after this procedure?
Wow. So this is going to be a little bit difficult for me. Because from what we have, the study is the number is too small to make an extrapolation in terms of statistical outcome. But then I know that quite a number of women achieve success with
this. Yeah. Great. Well, some persons claim that this is still an experimental thing and it's not really a thing yet to say that it guarantees conception. Do you agree with that assertion?
Yeah, of course. If you ask me, everything is experimental. Even the IVF looks experimental. The fact, in IVF, for instance, the global world success rate of IVF is about 35%. What happened to the 65% of people? Will you want to call it experimental or not? It's just a medical procedure and doesn't give guarantees that it will be successful or not, just the way IVF itself is. A lot of women do IVF, they don't succeed. So ovarian rejuvenation is still in the infancy stage of organ rejuvenation, and it holds a lot of prospects. For the future. So yeah, it's experimental, but it is the only option that some women have. And so they should take it. It works for some. You keep on doing the experiments.
Oh, well, that's great. So, with all we've said today, ovarian rejuvenation is really hopeful. It's a hopeful procedure. It's not just hype.